Hello everybody, welcome to my YouTube channel, Homoeopathy Super Sessions by Dr. Jagos. Today, I'll be doing the part 2 on the editorial remarks on alternation of remedies, first part. Well, the third point is that, is there any other view from the practical standpoint? Dr. Hahnemann says that in a given case, the use of two remedies might work well, and that one remedy might work well and could have answered the purpose. So Dr. Hahnemann says that when you use two remedies, each in its own strict sense of homeopathy, the totality is taken, the law, the principle is followed, or the principle of homeopathy is followed, law of similar is followed, and then the remedy is selected and then it is given. So one may work well and the other remedy could have also cured the case. Now the question will arise, have I done the best I could? As far as the prescriber's own conscience is concerned, the answer is yes. So that in a case, if a case comes to you and you ask the question to yourself, have I done the best I could? Well, your own conscience will tell you, yes, I have done the best possible I could do in this case, even though the prescription was a faulty one. So even though your prescription was a faulty one, yet your conscience will tell you that you have done your best. However, from the practical point of view, alternations may be justifiable. But if you see from the practical point of view, it may be justifiable by doing alternation of remedies. But the constant question in one's mind will be, have I done the best I could? But even if you alternate the remedies, again, the question which mulls in your mind or which goes on coming again and again is that, have I done the best I could? If the answer is yes, it would always justify the prescriber. So if the answer was yes, then you have justified yourself or you have justified your prescription. Yet, if a practitioner of only 1 year experience may commit a sad blunder and yet be fully justified because of being young and inexperienced, he did the best he could. So if a practitioner is newly budding practitioner, he has only experience of 1 year in the field, and he commits a blunder or not giving the correct medicine or giving it in alternation, yet he says that he has done the best he could and he justifies himself that I have done correctly. Because, why? Because he was young and he was inexperienced. So this could be pardoned. However, would the same situation and the same blunder 10 years down the lane would have been justifiable? So the same practitioner, now he gets matured, he is 10 years in practice, and again, if he does the same blunder, would this be justified? Obviously, it would not be. Why? Because the practitioner always do the best he can. So the practitioner should always try and do in each and every case the best possible thing which he thinks according to him is best. Thus, it can be done by studying with great earnestly the materia medica. So in what way he can do the best? That in each individual case, whatever remedy is coming up, he has to study the materia medica with great earnesty. Determination should be there to always do better and better next time. So the practitioner should be determined that in every day, in every case, I will do better and better and better. And I will improve myself, so that we can go against the alternation of drugs and have a clear conscience that I have tried my best always. So if you try and improve yourself, naturally, you will then, in your initial days of practice, use alternation of drugs. But as and when you gain experience and when your conscience becomes clear, you will go against the alternation of drugs and prescribe a simple single remedy. The fourth point, we must always appeal to the experience of Hahnemann, who knew materia medica better than any other man and also had more practical experience. So therefore, he said that we must always look into the experience of which Dr. Hahnemann had, his vast experience, and he had the best experience as compared to any other person during that time. And also, he had more practical experience. The experience of each individual homeopathy practitioner should be measured by the actual number of years in practice. So basically, the editor says that the experience of each individual homeopathy practitioner should be measured by the actual number of years in practice. Okay, so he gives an example saying that the organon book was written in this year. So therefore, the physician, the practitioner at the present age cannot say that he has so many years of experience because the organon book was written in a specific year. So he cannot count that years of experience, but he has to count the actual years in his experience. Now he has assimilated the fact in his own mind and how rightly has given the application to it to cure the sick. So more the experience you have, more mature you will become, and as a result of which you will be able to assimilate the facts correctly in your mind to each and every case, and you'll be able to apply the facts of each and every case properly in order to cure the sick as you go older and older in practice or as you mature in practice. You must always learn to rely on facts as what Hahnemann did. So again, once again, the reminder is that always learn to rely on facts and not on theories. Do not build theories. Do not build hypotheses. Always, what are the facts are there? That means whatever symptoms are there, whatever facts are there before you, you have to take that into consideration. We cannot doubt Hahnemann's ability and capacity in his work in the materia medica. So therefore, naturally, Hahnemann was a great person. He has put his whole life for the upgradation of homeopathy, and therefore his work on materia medica and his ability and capacity cannot be questioned. If we do, then we will be risking our patient's life. So if we have a doubt on Hahnemann that what he's done is not right, maybe his proving wasn't correct, maybe this was wrong, maybe that was wrong. So if we do that, if we would doubt our great master's ability and capacity in his work of materia medica, then what will happen? We will be risking our patient's life. Thus, we have to be honest and hardworking in order to attain success in practice. So initially, we have to work hard, or rather throughout our life, we have to work hard in order to find out the correct medicine for the patient. Then only we'll be able to attain good results in our practice or success in our practice. So that's all what the editor wants to tell you in this part. I hope you like my video. Thank you very much.